Hi, Adriana. How are you?
Hi, Aarón. I'm fine. How about you?
Well, it's good. It's fine for now.
Okay, I'm happy you're fine. I wanted to talk to you about the coronavirus. We have lived through a very long pandemic, and I wanted to ask you a few questions.
Okay.
So, what do you know about the coronavirus so far?
Well, for the knowledge I recollect, well, so far, I know that the coronavirus is a virus that has killed many lives since the year 2020, and that it spreads very easily in close places, and especially where it is a large influx of people. Consequently, it is not advisable to stay indoors with a large numbers of people because this only make you more propense to catch this virus.
Yes, I agree with you. Also, since COVID started, I think there has been a lot of myths and fake news has abounded on social media because there was a lot of uncertainty. Like very little was known about the virus, and that scared people a lot because some symptoms were very severe, like fever and a lot of tiredness and headaches and a sore throat. So people got scared very easy.
Okay. From the recently notice, what do you think about the vaccination process against COVID-19 in your country?
Oh, so COVID vaccination process, I think it began on February 2021, approximately. The vaccine was and continues to be free and can be applied to everyone that lives in Peru from, I think, the age of 5 years and older. And first, they vaccinated the entire field of healthcare, like doctors, psychologists, um, dentists. Then I think it was people with some health conditions, like people that had cancer or a heart disease or a lung disease, and among others. And then it continued like with the rest of the population, first with older adults, like from 80 to 70 years, then 60 to 50 years, and so on. And many people believed that the vaccination process was going to take a long time. At first, it was slow, but luckily, it was more or less quick then, and everything was organized very well. And many people are grateful to be vaccinated nowadays.
Well, like you mentioned, to be honest, the vaccination process against COVID-19 was very slow at the beginning because
Mhm.
there was no good control of those vaccinated. However, with the pass of the time and the pass of the months went by, this process was improved, like you mentioned before.
Mhm. Yes. And what do you know? What have you heard about food or habits or maybe exercise that were useful for people during COVID?
Well, this is a little curious. One of my diary recommendations is to drink hot ginger water. That helps you clear your chest and sleep very well. On the sports side, the best type of exercise I could recommend maybe could be cardio. Why? Well, this way your body will stay active and will prepare for this type of virus.
Yes. I would say it was highly recommended also to maintain a balanced diet, eating a lot of fruits, vegetables, and protein because they have a lot of vitamins. And also exercise, as you said, staying healthy and active was important. And as well, to drink a lot of water to help the immune system. But for this, like a lot of people had different opinions, and especially for nutrition topics, people made a lot of generalizations. And you know that each person has his own diet and exercise, and we shouldn't follow always what the internet says. So there was a lot of myths also about that topic.
Okay, perfect. Uh, from the recently noticed, what do you think or what governments or people in general can do to prevent and slow down this type of transmission?
Okay, so the government really imposed a lot of rules, like the mandatory social isolation for many months, Also the curfews that we could only go to the streets or go out in general on certain hours of the day. Also the use of masks was obligatory, physical distance or double masks in certain places. So basically like they limited contact between people. And personally, I think that at sometimes some rules appear to be very exaggerated and excessive, but it was the government's way to protect the population. So it's also appropriate to create those rules.
Okay. In my point of view, the governments need to put security measures in various establishments where there's a large presence of people. Only in this way we can maybe COVID-19 can be stopped in time. A part of that is there was no sanitary measures. People will do whatever, and that will be affect others. So it's so necessary to push sanitary measures in the way like we can fight against this type of virus.
Do you think that sometime a scientist or a doctor or a virologist will ever find a cure to coronavirus?
Well, I find it like is very difficult because the latest studies present that the coronavirus 19 is a virus with the ability to evolve. So it's too difficult to find a cure for such a virus with this type of capacity. The only thing that can be done at the moment is to prevent getting such a virus and continue studying this type of virus to see if a cure can be found in the future.
Yes, I agree with you. And also, science is moving faster and faster each year, so we never know. But hopefully, they can find a cure and we can forget about COVID because it has been very harmful to society.
Okay. Uh, well, in general, what do you think will be the main challenge that COVID-19 has brought to us?
Oh, that's a great question. In my opinion, adapting to all kind of virtuality has been a immense challenge, like to the new forms of working, to the learning methods, because children weren't able to attend their schools for many months. In Peru, it is known to have closed for 2 full years, the schools. So adapting to virtuality was very difficult. It was a real challenge. Also, in some provinces, families don't have access to internet, so it was very difficult for them. Also, in general, all economic aspects were an enormous challenge. Like people lost their jobs, many businesses were closed, and that was so bad, so such a bad consequence of COVID. And finally, like treating diseases was very difficult at that time also because all hospitals, clinics, the health system in general was so overwhelmed during the COVID times, and some of them are still that way. And there were not enough equipments and space for the patients, and a lot of them died because of that, which is awful.
Yes, exactly. According to the mission, one of the main challenges that humanity experienced as a result of COVID-19 is virtuality in general. Due to the appearance of COVID-19, we all have to adapt to new ways of working or maybe studying. Being mostly virtual, which is very and why very time more people saw the need to learn new technologies to adapt to the new times.
Yes, I agree. And I have a last question. Has the pandemic taught you or people in general any important sanitary habits that we should maintain to take care of our health?
Well, in my point of view, one learning we can learn from this experience could be maybe use masks in crowded places or prevent this virus. Also, you can you can clean your clothes after you come to your house or with substance for prevent the to share this virus in your bed, in your bathroom, or in your kitchen.
Yes, many people criticize the use of a mask, but I think it's really useful. For example, in crowded places, as you said, like hospitals or in some transports like a bus. When you visit a sick patient, also, I think it's so important to wear a mask and many other situations. So I agree with the use of a mask. Also, wash your hands and disinfect objects.
I agree with you.
Okay, Aaron, it's been a really good conversation. Thank you for your time.
See you.
See you. Bye.
Bye.